Hi everyone. So in the last video we talked about the skeleton, and I mentioned that we would do a couple more videos to get in a little bit more depth about each bone. So in this video we are going to talk about the axial skeleton, which contains the skull, the spine, and the rib cage. So looking at our friendly skeleton, like I said, the skull, the spine, and the rib cage is what the axial skeleton is comprised of. So we're going to start looking at the back of the skull. So here is the occiput, and back here where these two are the parietal bones. As you can see, it's almost like the skull is one bone. There's actually only one joint, which is the mandible or jawbone. All the other bones are actually together or brought together with sutures. So turning back to the front, like I said, this is the mandible. This is our maxilla. Coming into the nose, this is the vomer, the nasal bone. Right above it, we have the zygomatic. We have the sphenoid bone, which you can see part of, but it actually goes kind of inside, and if you were able to sort of cut this part off and look inside, it looks kind of like a butterfly, and it comes across the face. It makes up some of our nasal passages. Within the eye socket, we have the ethmoid and the lacrimal. There's little bones on either side in here. On the side right here, we have the temporal bone, and this very front one is named the frontal bone. Turning around our skeleton here, we're going to move into the spine. So we have 7 cervical spine, or vertebrae, I should say specifically. Each vertebrae has different landmarks, again, that we will talk about in depth when we talk more about the muscles. There's areas where nerves and, of course, the spinal cord going through, nerves coming out that affect our arms and legs. Just briefly talking, though, of course, looking at it, you can see that this right here is the spinous process. It makes up what a lot of us can see when we look at someone's back, and the transverse processes, which are on the side. You will notice the very first vertebrae is known as the atlas, and the second vertebrae is known as the axis. C1 for short does not have the spinous process, part of it being so close that our skull sits on it. And C2 actually has a little knob that sticks up and goes through. It actually is what helps with the turning and rotation of our head. So again, we have 7 cervical vertebrae, and then we have 12 thoracic vertebrae, which are 12 ribs connect to. We have 5 lumbar vertebrae. We have our sacrum, and then our coccyx. So coming back up to the thoracic spine, like I said, the ribs connect to it. So we have a total of 12 ribs. 1 through 7 are called true ribs because they come around and directly connect to the sternum. Ribs 8 through 10, well, I should say ribs 8 through 12 are considered false ribs, but ribs 8 through 10 come around from the back and attach to the sternum through cartilage. You can kind of see how they come together here into kind of one or two. And then ribs 12 and 11 are actually known as floating ribs because they connect to the back of the vertebrae, but they do not come around to the sternum at all. And then our sternum is actually broken up into three sections. We have the manubrium, which is up here. We have the body of the sternum in the center, and then we have the xiphoid process. So, like I said, there are some other bony landmarks in relation to everything that we will talk more in detail with when we start discussing our muscular system and how it attaches and makes our body move. So stay tuned